What does the BCG vaccine scar mean? Imagine a tiny mark that tells a story about your body's fight against tuberculosis. That mark is the BCG vaccine scar, a small, raised, round spot that usually appears on the upper arm after vaccination. It is a normal part of the immune response and often serves as a visual proof that someone has received the BCG vaccine. This vaccine is given to protect against tuberculosis, a serious lung disease caused by bacteria. When the vaccine is properly administered as an intradermal injection, the body reacts by forming this scar over several weeks to months. The scar indicates that the immune system has responded to the vaccine, which is a good sign that the body is prepared to fight TB if exposed later. The size and appearance of the scar can vary depending on how the vaccine was given, the strain of the vaccine used, and individual factors like age, sex, and vaccination history. For example, a well-injected vaccine usually produces a small, raised, round scar, while improper injection might result in no scar or a different appearance. Interestingly, the presence of a scar has been linked to a stronger immune response, meaning that people with a visible scar might have better protection against severe forms of tuberculosis. In many countries, especially where tuberculosis is common, the BCG scar is used as a simple way to verify if someone has been vaccinated, especially in children. It helps health workers quickly identify vaccination status without needing records. However, it's important to remember that not everyone develops a visible scar, and the absence of a scar does not mean the vaccine was not effective or not given. Some individuals may not form a scar despite proper vaccination, and this is perfectly normal. The BCG scar is different from the smallpox vaccine scar, which tends to be depressed and has radiating lines. The BCG scar is usually raised with rounded edges, making it distinct. Rarely, some complications can happen at the scar site, like chronic inflammation or, very rarely, skin issues such as abscesses or even skin cancer. But these are extremely uncommon and do not outweigh the benefits of vaccination. Overall, the BCG vaccine scar is a sign that your immune system has recognized and responded to the vaccine. It is a useful marker in public health for tracking vaccination coverage and is associated with protection against tuberculosis. If you have questions about your vaccination or scar, it's always best to consult a healthcare professional. Remember, vaccination remains a key tool in preventing serious disease, and the scar is just a small but meaningful reminder of that protection.